Hello and welcome to Experiência do Paciente, a podcast produced by SOBREXP, the Brazilian Society for Patient Experience and Person-Centered Care. This episode is part of our special series Behind the Scenes of the Future of Patients' Experience, created by SOBREXP, following the third International Congress held in Brazil. For this series, we spoke with four remarkable guests who took part in the Congress. Four people from four different countries, each bringing a distinct perspectives on a future of healthcare and caring. In each episode, we draw on one guest's experience and expertise to create a focused and accessible conversation, one that invites us to reflect on the future we want to build. Our guest in this episode is Giuliano, the president of Planetree International, who is gonna talk with us about how do cultures really change. Ready to join the conversation? Let's get started. I'm Tulio Fonseca and it's a pleasure to have you with us for this episode. Hi Michael, well, welcome to the podcast Experiência do Paciente. It's a pleasure to have you here. Transforming culture, that's our challenge for today.
Great, big challenge.
Big challenge.
Yes.
Yeah.
Well, thank you Tulio for having me on the podcast. It's a real pleasure to support your community and our global community with new ideas and conversations about how to tackle culture and innovations to bring person-centered care to life. So,
Michael, I'd like to start my interview with you by asking the following. Many organizations say that they want to change their culture. Why do well-intentioned initiatives fail when they reach everyday practice?
Yeah, this is a great question, and it comes down to sustainability. And it comes down to co-design. So we've worked with lots of organizations at Planetree around the world for many years doing exactly this, about how do we transform culture and change it using person-centered care principles. So a few things. One is we see well-intentioned organizations getting excited by changes and sort of jumping quickly to solutioning without spending the time to bring everyone along the journey of creating the foundation of why is person-centered care important? Why do we need to change? Who needs to be involved? Who needs to be at the table in terms of this conversation?
Okay.
So what we've learned is if you want to go on this path of cultural transformation, there's a certain way that you should do it to really create the foundations and the structures before you start implementing change. And that's why we've developed our Planetree method, that you start with creating a baseline of how are you currently operating and how does that work against international benchmarks? Then creating the foundation of ensuring your board, your C-suite, your middle management, and all of your frontline caregivers, both clinical and non-clinical, understand what PCC is. Why is it important? How is it aligned to the mission and values? How is it aligned to their individual goals? Because if you jump to start of creating new experiential change or cultural updates, people don't understand why. They don't have an engagement in it. They don't have ownership in it. It's being done to them, not with them. So you have to set that groundwork first. The second is one of our key enablers of our Planetree person-centered care framework, which is experience-based co-design. That it's very easy to make changes and cultural improvements for people instead of with people. So co-design is based on the thinking that how do we bring the voices and the authentic lived experiences of people who will be impacted by a change, an improvement, or a cultural update to the table to understand the problem, design the improvement, test and refine the improvement, and sustain it. And how do we ensure that it's not top-down pushing a solution, but bottom-up creating that solution? And I'll give you an example. When I was working at a public institution in Australia, we had a big problem with nursing overtime. And the immediate sort of idea from the executives was, well, cut nursing hours, say that you can't charge overtime, that's how we're going to control the cost. And we said, Well, before you actually do that, let's go to Gemba, that idea from Lean Six Sigma. Go to where the problem is and spend time talking to people that are experiencing this problem every day and understand what's going on. And when we did that, we found that we were creating an environment whereby we were asking our nurses to do a lot of non-value added tasks of administration, of the medical record, of finding things, of trying to track down doctors, that of course they were going to have overtime because they were spending so much time not doing their main jobs. But instead of pushing a solution to them, we created co-design teams to say, here's the problem, but nurses on this ward, we're going to give you a budget, we're going to give you autonomy, we're going to give you the competencies and education on this committee whereby you come up with the solution because you have to live with that solution every day. That thinking about co-design is much different than what we normally do in healthcare, which is we think we know the solution, tell this ward or tell these nursing groups to do it, and then we'll move on to the next problem. And then we find or are disappointed many months or years later when that's not sustainable. But what we found in giving the nurses on the ward where they were experiencing the problem, the ownership and engagement of coming up with a solution, their overtime went back to zero, and they sustained it because they would be embarrassed if it didn't work because it was their idea. So by co-designing and engaging and giving ownership and value to people in solutioning problems, we can not only change culture and change it positively, but also sustain it. So I know that's a long answer, but the two components for me that are so important are co-design and setting the foundation of knowledge for cultural change to be effective. And then we all know from cultural transformation naturally comes organization performance improvement, better outcomes, better experience, not only for our patients, but as Planetree defines the person as the patient, family, staff, and the community.
Okay, which leadership behavior must undermine the culture of person-centered care, even when the organization's discourse seems appropriate?
So this question really gets to thinking in words versus actions. Okay. So we can very easily say that we have values of culture and supportiveness and all these things that we talk about in our mission and vision, values and behaviors. But actually seeing it being lived is, and supporting that lived experience is a different thing. So leadership behaviors that we see undermine cultural transformation is not being curious about what's happening on the front line of an organization. By just looking at numbers and not understanding the humans, the employees and patients behind those numbers, you can really start to make uninformed and sometimes dangerous decisions that undermine your culture. So what do I mean by that? Is that, yeah, you can do rounding, but if you're not doing purposeful rounding, of really being curious about what's happening, how I can remove barriers, then you're undermining what you're telling your staff is important. If you're saying that I'm interested in being a good leader and creating a new culture to support you, but not then showcasing it, you're actually doing more damage than what you did before in your old way of working. So being curious about what's happening on the ground is a leadership behavior that we don't see happen often. The second leadership behavior that undermines cultural transformation is consistency and relationships. Great. That we don't consistently support the values that we've set out, or we don't spend the time on creating relationships and understanding people that work for us and that are in our care. Okay. And that, I think, so not being curious, not supporting relationships, really undermines any cultural journey. Because if the front line doesn't see leadership as finding this important, we're not going to make any changes.
Okay, Michael, what do organizations that truly transform their culture do differently? And how do they recognize that change moved beyond discourse?
So I'll take the second question first. How do they know that change moves beyond discourse? And it gets back to measurement, but measurement in a different way, not the traditional sort of NPS measurements or HCAHPS measurements or satisfaction measurements, but measurements that really indicate qualitatively and quantitatively what the lived experience is like. So what I mean by that is, like I spoke about in my discussion, is some organizations measure, do you remember the first name of your care team, someone on your care team? Or can you remember a positive experience about your onboarding?
Yeah.
And what is that?
Yeah.
So it's how do we get to the fundamentals of lived experience from the authentic and genuine voices of people who are actually living it. So that's how we can tell or take the temperature barometer of, we're not just saying things, but people are feeling it. People are living it and feeling it. The discourse is now reflected in what people are telling us what they feel. And organizations that do that differently recognize that they're not perfect. They're honest and transparent about that. They're clear about their vision. They're clear about making it a priority. They back that up with the knowledge, the support, the resources, the pathway to support their team members in realizing that vision, and providing people progress and celebrating small milestones along their way to creating that future culture. Because as we all know, culture takes a long, long time to change. And if we're not celebrating small wins along that journey, we can very easily become demotivated, that things aren't changing or things aren't working, and then our whole pathway, our whole vision starts to crumble.
Yeah.
But if we're taking people along that journey to say, we know we're not the best just yet, we're open and transparent about that, but we have this pathway, we have this vision, we're giving you the knowledge, resources, time, and tools, the autonomy, the creativity to get there. We're going to celebrate all of our milestones as we continue to improve. That's how you keep top of mind that culture is important, that is valued at the organization, and we're on our path to improve it.
And to wrap up our conversation, we've been asking all the guests the same question. Ready? So, Michael, please complete this sentence. 10 years from now, healthcare will be more human
if we systematically personalize all experiences. And what do I mean by systematic personalization? Because we talk about this a lot at Planetree. Is for our patients, our families, our staff, how can we see each person as the unique individual or unique human being that they are? And with that knowledge, how can we honor those preferences and those values and those differences in the care that we provide, in the experience that we provide, in the infrastructure and the processes that we provide? Not standardizing to a point where we become transactional, but systematically personalizing each experience to what's important to the individual, and making this, again, a relationship-based business, a relationship-based industry of healthcare, that it's individuals caring for other individuals in vulnerable, troubling times of their lives. So if we're going to make things more human, we need to institutionalize, embed, make it daily practice, daily culture, personalizing an experience for every single person whenever they're touching or interacting with our organization, be it within it or outside the four walls of it. And I know that's a hard ask, but it's the only vision and motivation that will get us to a point where we're putting humans and what makes humans different and unique into every interaction.
Okay, Michael, thank you very much for sharing your insights with us today.
Of course, and thank you to all the listeners for your compassion and your dedication to this work, and we're always here and happy to share more ideas in this community that we've created to push this global movement forward. So thanks for the opportunity again.
Yeah, sure. And we've come to the end of this episode with Michael Giuliano, president of Planetree International. We talked about culture, leadership, and change. Listen to the other episodes in Behind the Scenes of the Future of Patients Experience. 4 different people, 4 different nationalities, 4 different perspectives. In the description of each episode, we're gonna find a transcription in Portuguese, Spanish, and English. Listen to them, read them. They were made for you. See you in the next episode. Bye-bye.